Good morning, everyone. Welcome back to Saddleback Eye Center. This morning I'm going to go over your drops and how to take care of your eyes after the LASIK procedure. So all of you have received a green bag from us. So if you want to go ahead, open that bag. You all have a blue folder inside of that bag. Open the folder up, and inside the folder you all have a piece of paper that looks like this, the LASIK post-op instructions chart. So this chart actually started last night, and you can go ahead and check mark off. We want to make sure that you use the moxifloxacin, which we'll call Moxie, 4 times from when you left our office yesterday until you went to bed, and then prednisolone, which we'll call Pred, 4 times a day from when you left our office to when you went to bed. You probably alternated them about every hour, like the Moxie at, we'll just say noon, the Pred at 1, Moxie at 2, so on and so forth. So this morning we're going to start on this chart at day 1 after the LASIK procedure. So starting today, you will be doing the Moxie 4 times a day for the next 5 days, and you will be doing the Pred 4 times a day for the next 10 days. So you're going to alternate these about every 2 hours. So if you did the Moxie this morning at 7, we'll do the Pred at 9. The Moxie at 11, the Pred at 1, so on and so forth. After the 5th day, you're all done with the Moxie. You will continue on with the Pred for 4 more days, days 6 through 10 after LASIK, 4 times a day. So it'll be a little more simple, like you could do the Pred at breakfast, lunch, dinner, bedtime. After the 10th day, you're all done with the Pred. That will leave us with our very last but most important drop, which is the Sustain Ultra Preservative Free. So these drops you can buy at any drugstore, Target, Walmart, CVS, even on Amazon. And even though these are over the counter, these are by far the most important drops that you will use after your LASIK procedure. So these drops and how good you are about using them ultimately will help get you the best, most crisp, clear vision. So starting today, day 1 after the LASIK, for the first month, you want to use these drops at least twice an hour while you're awake. Months 2 and 3 after the LASIK, you want to use the lubricating drops at least hourly while awake. Months 4 through 12, you want to use them at least 4 to 8 times a day. But really with these drops, there's no such thing as too many. The more, the better. If you want to use these twice an hour for the whole year, you're even better off. However, I will tell you, never use drops closer than 5 minutes apart, such as if you just use the Moxie, don't 2 minutes later use this. Wait a good 5 minutes, and then you can go ahead and use the Sustain Ultra Preservative Free. Keep in mind, each of your eyes can only handle 1 drop per eye, like I said, every 5 minutes, so don't try to do it closer because we don't want to rinse out the medicated drops. Another thing to keep in mind with the Sustain Ultra, they come in these little vials like this. So these vials, you can twist the cap off, do a drop in each eye. You can actually put that little cap back on like that, so you can actually get usually 4 to 5 uses out of each one of those little vials. After 3 months of using the preservative-free vials, if you would like to switch over to Sustain Ultra to the little bottle, you can. Or if you would like to keep using the vials, you can do that as well. So that's really it as far as the drops. As far as the restrictions, just to remind you, you will be using the goggles while you sleep, the clear goggles for the next 5 nights. During the day, we want you to either use the clear non-prescription glasses we gave you for during the day, or you could use sunglasses. We just want to make sure you're keeping those eyes covered at all times for the next 5 days and nights. And along with that, no swimming for the first week. The second week, wear waterproof goggles. After the second week, you don't have to worry. No perspiration in your eyes for 10 days. You can certainly work out today all you want, but just use like a towel, sweatband, or hat. Keep in mind, it's not the end of the world at all if you got sweat, dirt, dust, shampoo in your eyes. But what's bad is you rubbing your eyes. So if you do get, we'll just say, shampoo in your eye, instead of rubbing your eye, just use the lubricating drops, and that way you can just kind of drop, rinse it out. Not a problem. No heavy weightlifting for 3 days. Heavy meaning more than you're accustomed to lifting daily, such as over 100 pounds. And then, of course, just for the ladies, no eye makeup for 3 days. As far as showering, so last night you could certainly shower neck down, but starting today after we see you, you can shower normally, you can wash your hair, wash your face, all of that. What I would tell you though is make sure when you're in the shower, let the shower water hit your forehead, keep your eyes gently shut. Let that shower water stream over your face for 3 to 5 minutes with your eyes gently shut. That is really going to be the #1 way to help you clean around that eye area without you touching, rubbing, or squeezing at all. Of course, when you want to wash your hair, just make sure the shampoo is going down your back, not down your face. Like I said, though, if you did get shampoo in your eyes, just please use lubricating drops to rinse it out instead of rubbing your eyes. We want to be very careful to not touch, rub, squeeze, blot, dab, any of that around the eye area. However, there are 2 rules to remember when cleaning around your eye area, because I know you're doing quite a few drops, so you will want to clean around that eye area. Rule #1 is what we call the 1-inch no-touch zone. And that just means 1 inch, 360 degrees around my eyes. I don't want to touch, rub, or squeeze. However, when we do want to gently clean around the eye area or remove eye makeup, remember the rule: if there's bone, you're safe. And what I mean by that is if you feel there's bone like down here, it's okay for me to put pressure, gently pull away from my eye area, use a wet Q-tip, gently dab. Same thing up here, I can go like this, pull up, and then gently pull away from my eye area. You're wanting to make sure you're being very gentle and not putting any direct pressure over that corneal flap area. That is certainly what we want to avoid. So just be sure when you're blinking, you're not putting a lot of pressure over your eyes, not squinting, not comparing your eyes, anything like that. Just blink gently as normal. Another thing, some of you may notice there's redness around the white areas of your eyes. That is purely cosmetic, very normal. It has no impact on the vision. That will all go away, but it can take up to 3 weeks. Enjoy your new vision.